The final item of business today is a members' business debate on motion number S4M 05976 in the name of George Adam on MS Week 2013. This debate will be concluded without any questions being put, and I would invite members who wish to speak in the debate to press the request to speak buttons now or as soon as possible. Mr Adam, 7 minutes, please.
Thank you, Presiding Officer. You'll be aware, Presiding Officer, of my own involvement within the MS Society and a member of the Paisley and District branch of the Society. But you'll also be aware that my own wife, Stacey, has MS, and I'd like to welcome everybody to what is effectively Stacey's MS debate, because if I think for 1 minute that it's actually got anything to do with me, then I'm surely kidding myself on. Because, like a lot of people, until I knew Stacey and we became married, I didn't know much about multiple sclerosis, and there was quite a lot of things about the condition that a lot of people didn't know. But I'd like to mention at this stage, Presiding Officer, that Stacey's here today with her mum and dad, and her dad, incidentally, is 75-year-old today, so it's his birthday today. And part of his birthday present was actually working for me as a volunteer within the office for the past couple of days, and he currently is the oldest intern within the Parliament. But they're one of many families dealing with this indiscriminate disease. And incidentally, Stacey was diagnosed at 16-year-old, and it's one of the things when I said earlier on about how people can misunderstand the condition. Well, Stacey's family are a perfect example of this. Stacey's mum was a nurse, a health professional when she was working, and she understood what MS was, but she asked Tom, when he went to see the consultant, he asked her specifically, asked him about multiple sclerosis, and Tom asked the job. And Tom just told me this story last night, and he came back that night and he says, "Yes, Rosemary, you're correct, it's multiple sclerosis." But Tom, having no idea what it entailed and what it was, actually just said he'd given the message back, and Rosemary, a very strong individual and woman, broke down into tears and started hugging Tom, and then from then on Tom knew exactly what they had ahead of them. And it can be very difficult for people with MS because lots of people misunderstand the actual disease itself. There's various versions of it. There's benign, relapsing, remitting, secondary, progressive and progressive. In our own position, Stacey has gone from relapsing, remitting MS to secondary progressive. And I think when you see how it can make a difference to people's lives and families, because most people diagnosed with MS are between the ages of 20 and 40, at a time in their life, at the peak of their life, when they're looking to the future, thinking about their careers, thinking about family, and being diagnosed with such a devastating, complex condition can really change how the life course, your life course and what you're wanting to do with life. But I've always found everybody that I've met that has MS, don't mope, don't go about complaining about woe's me and the situation they're in. They all seem to be very positive because they actually take it, say, yes, I have this incurable condition, but I will grab life and I will make the most of it. Stacey, when I first met her, one of the reasons why was our sheer lust for life. You thought I was going to say me there, didn't you? Our sheer lust for life was the main reason that you found so attractive, because she lived every day as if it was its last. But it is an incurable condition. It's a result of damage to the myelin, the positive sheath surrounding the nerve fibres of the central nervous system, which interferes with messages between the brain and the body. And there was actually there's a couple of Facebook groups that are quite interesting, that women who have rather strange names about their sisterhood almost, because more women than men get MS. And I won't mention them here because it probably wouldn't be too polite within this company, but it can check it out yourself at a later date. But symptoms can include intense pain, problems with mobility and coordination, and severe depression, deadening fatigue and incontinence and loss of vision. Now, some of the things that no two people have the same type of MS as well, and everyone can be different from one another. But the statistics are difficult for anyone to comprehend, because Scotland has amongst the highest prevalence rate of MS in the world, with an estimated 10,500 people living with MS in Scotland. But MS does not just affect the individual, as I've already mentioned, it affects their family as well, and friends and colleagues, so meaning the actual figure is over 63,000 people in Scotland. only 10,000 less than the population of the great historic town of Paisley. So it's quite a lot of people there when you look at that. But with all that, there are some funny things with MS, dark humour, things that when you look at how you deal with it, because it's a positive outlook. And there's talk of Stacey and her mum when she was just no long diagnosed before they had the extension, the two of them falling down the stairs on top of each other, and instead of lying there in a heap crying, they just looked at each other and started laughing, because what a bizarre situation for the two of them to be in. Stacey leaving for high school for her Hires exam and wanting to do it on her own and being independent with a patch in her eye because she had double vision at the time, and her mum watching from the highest point in the house, trying to actually see her get to school to make sure she was okay, while at the same time remembering she had a young independent woman who wanted to live her own life. So, in my own situation, when Stacey and I met each other 2 weeks after we got married, Stacey turned round to me and said, "George, I've got double vision. I'm seeing two of you." Well, how lucky can a girl get? There was also the situation where Stacey and I, during the first 10 years of our marriage, because of the short-term memory loss, I won every single argument because I said, "I told you that." That's what I said. So these are some of the things that you go on with within the situation. I remember I mentioned at Liam MacArthur's MS debate about a rather personal part of what some of the condition that was affecting Stacey. And I think I mentioned it, Mr MacArthur, but I think I got away with it. Other people will say otherwise. I won't go down that route at this stage. But in October last year, the MS Society conducted the My MS, My Needs survey, and it went out to 10,000 members throughout the UK. And some of the figures that came back were quite interesting. 53% had offered to attend a self-management course in Scotland, and that is one of the ones that we are the highest. A quarter of people said they could not see their neurologist when they needed to. 9% of people who had wanted to be involved in clinical trials had been given the opportunity, and 36% who were eligible to take medicines that alter the course of MS were only 36%. Now, these are all facts and figures, but below that, underneath that, is some of the stories that I've been talking about today, real people's real lives and real issues. And I think we have to look at some of the challenges that will come up in the next couple of years, as welfare reform will have a massive effect on people with MS, because people don't understand the different symptoms for everyone, the lack of understanding and belief regarding the condition, and the lack of expertise in the assessment and the fluctuation of multiple sclerosis amongst individuals. We're not just talking about a disease where it changes from week to week, month to month. It could change from hour to hour. That's the big thing about MS as well. So I would like to close. I would like to actually some of the positive work that's going on out there as well. MS Revive, based in Maryhill in Glasgow, are doing great outreach work within Paisley, Cathcart, Hamilton and Douglas. And they absolutely love the work they do, because they work with the individuals, talk to them about how they're dealing with their MS. And a lot of time, tea and sympathy makes a big, big difference to people who are dealing with these issues on an ongoing matter. So I'll stop at this point. Presiding Officer, you have been more than kind with the time you've given me. But I believe that we have to remember it's real families behind the stats. There's real families, real people dealing with these real issues, and that's what we have to remember. And working with the public sector, charitable organisations and health professionals, we can't start working towards making things better for people who are dealing with the challenges of multiple sclerosis.
We are quite tight for time today, so if members could restrict themselves to 4 minutes, that would be very helpful. Malcolm Chisholm, to be followed by Claire Adamson, please.
Presiding Officer, I'd like to start by congratulating George Adam on introducing a very important debate in an informative and also very humorous way. Clearly, it's very important that people should learn more about the condition. Certainly, an earlier report I looked at called Fighting Back by the MS Society highlighted that a lot of problems that people with MS have spring from the attitude of others, and clearly that is often based on lack of knowledge. So it's important that we find out more. But of course, today's report report, which George Adams highlighted in particular, also tells us about some disparities in the level of service. Now, I think we should recognise that it's a balanced report, because there is good news in the report, as George Adam emphasised, in terms of self-management, for example. The levels of self-management in Scotland are actually much higher than they are in England, and credit should be given to the Scottish Government for investing resources in that and making sure that more than half of people have the opportunity to be on a self-management course. But clearly, it would be remiss of us not to highlight some of the more disturbing figures in the report. I suppose the general issue that is raised is that perennial tension between local decision-making and national standards, and that gives rise to what is often called postcode care. Again, however, I think we should give credit to the Scottish Government for actually having national neurological standards. I think that was a really important development in the last Parliament, and part of those standards were generic, but some of them, 3 of them, I think, were specifically about MS. And not only did they have the standards, but they were then the report, peer-reviewed report that came out last year. Well, I can't pretend to have read it all, but I did look at the Lothian report, and while some of the generic standards weren't met, it did say that the specific MS one on access to a multidisciplinary team was met. So I was quite pleased about that, although I have to say, talking to the people on the MS stall outside, they did say that that didn't always reflect the experience of individual people with MS. And again, George Adam quoted the figure of 75 people, only 75% of people able to see a neurologist when they needed one. So, I think we would have to recognise that there is more to be done there in terms of access to the multidisciplinary team, which is so vital. I hope the Minister, in his summing up, will tell us what the follow-up to the neurological standards is. I believe there is a neurological advisory group which is now overseeing the implementation of those standards, but I'm not entirely clear about its role and its powers. And clearly, actually, having standards is only the first part of the process, and making sure that there is progress on implementing them is clearly the necessary follow-up. I would also be particularly interested to hear from the Minister about access to drugs. Again, this is very much featured in the report, and George Adams referred to the worrying figure of 36% of people having access to the drugs, I think, which they might benefit from. So that is a matter of concern. But I certainly remember from my days when I did health, in 2002 there was a risk-sharing scheme set up for beta-interferon in particular, which was supposed to improve access to that range of drugs for MS. So, again, I've lost track of what's happened to that over the last 11 years. But obviously, as part of the general summing up on drugs, I would be interested in particular about what happened to that particular scheme. Now, as I've indicated, the report says we're good on self-management, and there are also loads of examples within the NHS and without of excellent services. And on Friday, I'm going to visit the MS therapy service centre based in Leith, which has outstanding person-centred holistic care for people with MS, with services such as oxygen therapy, neurophysiotherapy, reflexology, aromatherapy and massage. My time's nearly out, so can I just quote something from today's report? It says, "The clinical standards and upcoming changes to health and social care put Scotland in pole position to improve services for people with MS." So, while recognising that there is still a lot to do, I think there are grounds for optimism, and I think we can expect further progress.
Many thanks. I now call on Claire Adamson to be followed by Nanette Milne.
Thank you, Presiding Officer. Can I congratulate George Adam in securing this debate this afternoon to highlight MS Week and some of the very great work that's done by the MS Society, a UK charity, across the country in dealing with this terrible disease. I have no great knowledge in this area. I'm not an activist like George who campaigns for MS. However, like many families in Scotland, I have a close family member who suffers with MS. So my main reason for speaking this afternoon is just to show solidarity with other families and carers who deal day in and day out with the sometimes devastating effects of multiple sclerosis. Multiple sclerosis is a very complex disease, as George has pointed out. What we do know about it is it's the most common disabling neurological disease among young adults. It affects nearly 100,000 people in the UK. MS is most often diagnosed between people of ages of 20 and 40, so Stacey was younger even than the norm to be diagnosed at such a young age as 16. Research suggests it's a combination of genetic environmental factors that may play a role in its development, and this is why it's such a complex area that involves not only biomedical science research but also genetic research. And though we have many contributing factors that may cause MS, we simply don't have a secure cause of the disease at this time, which makes it very, very difficult to treat. And as George Adam has also pointed out, every single patient has a different experience of MS. There's also around a 2% chance of a child developing MS when its parent is affected, which is higher than might be expected in the general population. So although it's not considered a genetic disease, an inherited genetic disease, there is obviously possibly genetic factors here that we just simply don't understand. MS is almost unknown in places like Malaya or Ecuador, but it's very common in the UK, particularly in Scotland, North America, Canada, Scandinavia, Southern Australia, New Zealand. I'd like to just highlight to some of the great work that the MS Society has done. They have just produced this wonderful report that gives us a picture of what's happening around the country and gives us cause for concern and food for thought in that area. But that could not have been possible without the groundbreaking work in actually setting up a database for diagnosis for people with MS, and that project throughout the country, I think, has been groundbreaking because it provides them with a source not only of patients, and they can do these kind of surveys, but it's also invaluable to researchers who perhaps want to contact people with some of the groundbreaking treatments that are available for MS. It would be remiss of me not, as a politician, to mention the devastating impact of the welfare reforms on some people suffering with MS simply through this lack of knowledge about what the disease does, how it can affect people and how their condition can vary on a day-to-day basis. And I think some of the cases we have seen highlighted about people being really badly treated when assessing their ability to work, with the people doing so not understanding their condition has been very worrying. And I note it's not just for MS, but other neurological conditions such as motor neuron disease sufferers have faced some of the same complications, and that's something that we should be maybe putting right. One of the first questions I ever asked in this Parliament was about the guidelines for vitamin D to general practitioners, and although we still don't have a firm scientific consensus that vitamin D does play an important, could play an important role in MS and the development of the disease, there's no doubt that the health benefits of vitamin D are well documented, and it's important that we should all be aware of the importance as a North British country in a country in the Northern Hemisphere, in Scotland, that we are sure that vitamin D is covered in our dietary requirements. And thank you, Presiding Officer.
Thank you very much. I now call on Nanette Milne to be followed by Jackie Bailey. 4 minutes, please.
Thank you, Deputy Presiding Officer. Can I also begin by thanking George Adam for once again initiating what's become an annual debate during MS Week, and to congratulate the MS Society on its excellent report on MS services across Scotland and the UK, resulting from its My MS, My Needs survey carried out last year. Given the widespread occurrence of MS in Scotland, with some 10,500 people living with it, it's likely that all of us in the Chamber, myself included, will have some connection to an individual diagnosed with it. So I hardly need to remind members of the varied symptoms of the disease, from the cruel wasting of muscles to chronic fatigue and problems associated with speech and sight. A disease of unproven etiology and no known cure as yet, MS is a complex condition and can be difficult to diagnose. And that's why the work of MS Scotland through events such as National MS Week is so very important in raising awareness. Turning to the motion itself and the MS Society's report, it's clear that there needs to be far more emphasis on providing information for people with MS, on the treatments available to them, and on the planning and provision of appropriate support services. In the time available to me, I'd like to highlight just a few areas specific to Scotland. One of the striking findings of the survey carried out by the MS Society is that as many as 29% of people in Scotland do not have enough information about medicines which can alter the course of MS, and that of those eligible for such treatment, only 36% are in fact getting it. Moreover, with treatment advancing all the time, It's concerning to learn that in the Highlands and Islands and my own area of North East Scotland, only 9% of people wishing to participate in clinical trials of new and evolving medicines are able to do so. Other issues, such as access to care and support services, also reinforce the oft-mentioned postcode lottery. Regional differences are again highlighted in the report, with 80 to 100% of people in Edinburgh and the Lothians who need to, having seen a neurologist, whereas across Scotland at large, around 25% of people said they could not access a neurologist when they needed to. And this, despite the conclusion in last year's Neurological Health Service's final report that all but 4 of health boards were meeting the peer-reviewed criterion for access to an MS multidisciplinary team. I think MS Scotland's suggestion that every person in Scotland with MS should have 2 comprehensive reviews a year to assess their needs and levels of care and support required should be heeded, and perhaps the Minister will comment on progress in this area during his contribution. The report does give a more positive response in the field of mood and emotional support for Scotland, where we perform better than the rest of the UK, with 58% of need met compared to a UK average of 51%. However, as with all things, the fly in the ointment lies again with regional differences, where people in the Highlands and Islands do not feel they have the same access to emotional support as elsewhere in the country. And let us remember that for an individual with MS, emotional support is every bit as important as any other form of treatment and help. Finally, Presiding Officer, there is a clear need for people with MS to be helped to self-manage their condition, and this requires education and the provision of appropriate information. When we last met in this debate at the same time last year, speakers, including myself, spoke of the Social Care Self-Directed Support Bill, now an Act of Parliament. The key aim of this bill was to ensure that people with disabilities could be supported to lead a normal life and participate fully in society by having a greater say in planning for their care and a greater choice in the support available to them, so that care can be tailored to meet their individual needs. To achieve this, there is a need for government and the statutory sector to work together with the third sector to provide the tools and support which people with MS and other long-term conditions and, very importantly, their carers require to manage their lives. I'd be interested to know how SDS is working so far and the benefits that it is bringing to individuals living with MS. Presiding Officer, once again, I'd thank George Adam for leading this important debate. Thank you.
Many thanks. Now call on Jackie Bailey to be followed by Liam MacArthur.
Presiding Officer, can I also join with others in congratulating George Adam on securing this debate during Multiple Sclerosis Week? Can I also congratulate Stacey Adam on clearly educating George, but also I think she went further and made sure he didn't share some of the personal stories that I've certainly witnessed him sharing in debates previously. But it is absolutely clear that his passion and conviction has been born out of Stacey's experience. We're right to kind of recognise that 100,000 people across the UK live with MS, twice as many women as men, almost 10,500 people in Scotland, which is indeed, if not the highest, it's one of the highest rates of MS in the world. And it appears to be random, and I think Claire Adamson was absolutely right to describe some of the complexity underpinning the condition. But as one of the few original members of this Parliament, I said original, not older, I can recall that in 2000, campaigners did in fact descend on the Parliament, protesting about the lack of services, both in terms of treatment and in care, and they rightly challenged us to do more, particularly when the prevalence is so much higher in Scotland than elsewhere. And we listened, and we agreed that action needed to be taken, and indeed Malcolm Chisholm has described some of the action he personally took. And it has been a priority for successive governments. Circulars have been issued, standards have been set, resources have been made available. But it must depress us all that a postcode lottery still remains. And the kind of experience that people have on the ground isn't the experience we would want for them. At the time, I remember we were told that people in Turkey had a better chance of receiving the drugs they needed to deal with their MS than people in Scotland. Now only about a third of people who would benefit from taking MS drugs actually receive them. And that's about half of the number receiving them in Northern Ireland, never mind the rest of the UK. And only MS sufferers in Poland and Romania actually get worse treatment than we provide in Scotland. Now, the MS Society survey, I think, is extremely helpful. It also tells us that about 1/4 of MS sufferers say that they can't see a neurologist when they need help with their symptoms. And I know the Scottish Government has published very welcome clinical standards for neurological health services in 2009. Indeed, I recall them being welcomed across the Chamber at the time. But whilst the standards may have improved for those getting a service, clearly it's not made enough of a difference to those who require services at particular points in time. And it does remind me of an earlier debate we had in the Chamber this afternoon about funding for the third sector. You know, we have a policy framework that is largely right. We all agree across this chamber about what needs to be done. But 13 years on, the frustration is there is no consistent delivery on the ground. And we really mustn't allow this to continue. And I hope the Minister will drive real change so that the experience of people with MS improves in relation to their treatment and care. The survey also considered the emotional, social and employment impact of MS, and we do need to consider much wider the actions we can take to mitigate some of those wider impacts. 44% of people diagnosed with MS are depressed because of uncertainty about their future. So Nanette Milne was absolutely right to talk about the emotional support that equally can be provided. Others report experiencing social stigma due to a lack of knowledge and understanding in wider society. Others expressed huge fears about having to give up work prematurely. Ultimately, Presiding Officer, people with MS want to live as full and active a life as possible before their condition progresses. As George Adams said quite rightly, these are real people and real families, and we need to provide them with the treatment and support in order that they can do just that. Thank you.
Thank you very much. Now call on Liam MacArthur to be followed by Kevin Stewart.
Thank you, Deputy Presiding Officer. Can I too warmly congratulate George Adam on his motion on securing the debate, and let's be blunt, on securing the turnout for this debate that he's managed to achieve. It was, as Jackie Baillie said, an excellent speech, and while I don't think anybody should discourage Scottish men from sharing, it was quite obvious that there had been a degree of vetting by Stacey of his speech for this occasion that was dramatically absent, I think, when we had a similar debate back in March. I on that occasion, led the debate. In a sense, there's been much talk of the prevalence of MS in Scotland as a whole, but I take no pride in saying that the incidence of MS in my own constituency in Orkney is the highest anywhere in the world, at around 400 per 100,000, a number that's doubled, I think, since the 1980s. And again, I would fully concede that in preparing for that debate, I went on a bit of a voyage of discovery myself in terms of what the condition is, how individual, as Mr Adams has already indicated, the condition is, and how misunderstood it is generally. And therefore, I think it's very timely that we have this debate to coincide with MS Week, that the MS Society is to be warmly congratulated in its efforts to try and raise that public awareness. And I think the report that has been published to coincide with MS Week, again, aids that whole process of extending our understanding of the condition, the problems that each individual with that condition and their family, their friends experience. But also, as Malcolm Chisholm, I think, was right to point out, identifying where we're getting it right, the good aspects of what we've been able to deliver, and the improvements, as Jackie Baillie said, over successive administrations, but also identifying quite rightly where we're falling down. And I think there's been much reference to the disparity in terms of access to medication in Scotland compared to other parts of the UK. But another interesting aspect was the difference in terms of that access between different parts of Scotland itself. So there is, I think, a clear message that more needs to be done. I mean, obviously, this is not simply about medication. Malcolm Chisholm mentioned his imminent visit to the MS Therapy Centre in Leith. I had the privilege of visiting the therapy centre in Kirkwall shortly after being elected, and I was very struck by the commitment of the volunteer staff that were there involved in providing support to around 30 clients in Orkney, led by Bruce Mainland. And I think the other aspect of it is, I think Nanette Milne touched on this slightly in her contribution, the issue of isolation is one that can often be overlooked. And I wouldn't say that this is solely an issue in rural areas, but I think perhaps the challenges are even greater in rural areas. I think, speaking to Bruce Mayland at the time of that visit, I was also struck by the problems that they experienced in encouraging people to engage with the therapy centre in the first instance. And I note from the MS Therapy Centre's briefing for this debate that the first centre set up in Dundee in 1982 was delivered with the motto "Self-help is our way of action," and go on to explain that every person who uses the centre has taken the decision to take the personal charge of the management of their symptoms. And I think that's a very important ethos, but I think it brings with it challenges in terms of getting people to engage in the first instance. So, once again, can I warmly congratulate George Adam on his speech. May I suggest that Stacey perhaps has oversight of more of your speeches in other areas as well. I look forward to joining others at the reception this evening. Thank you very much indeed.
Thank you very much. I now call on Kevin Stewart to be followed by Neil Findlay.
Thank you, Presiding Officer, and I too congratulate George Adam on his motion and on securing this debate. I think the first reception I attended in this Parliament was the MS Society event, which was in Dynamic Earth not long after we first met in this session. And we had the opportunity to talk to a number of MS sufferers there. And that night, I learned probably more about MS than I previously knew, even though I know families who have an MS sufferer in them, and even though I'd visited the Stewart Resource Centre in Aberdeen, which was in my former council ward, on occasions before that. I was struck by the bravery of a number of the folk that night, and I went to the Stewart Resource Centre again to talk to folk there and to see an exercise session in practice, which was a bit of an eye-opener, I have to say. But, Presiding Officer, while I know that we have this service provision in Aberdeen, and great as it may be, I think my greatest fear, and the greatest fear of others at this moment in time, is the welfare reform agenda. The Welfare Reform Committee in this Parliament on the 5th of February this year listened to Marlene Hepburn, an MS sufferer from Stirling, a woman who was originally from the north east of Scotland, but teaching jobs took her elsewhere. A lady who worked as long as she possibly could, and a lady who was quite blunt about the difficulties that she had faced. But I think the most galling thing for Ms Hepburn was not the disease itself, but the fact of work capability assessment that she had recently been on. And what we have is a situation whereby we have vulnerable people who may be denied lifelines if various benefits are withdrawn from them. Nanette Milne talked about assessment, constant assessment, and I think that's fair in terms of ensuring that people get the best possible treatment. But one constant assessment that I cannot agree with is the constant work capability assessment that folks with MS and many other debilitating diseases will face under this current regime. I think, that the UK government needs to get this absolutely right. Lord Freud has refused to designate vulnerable groups and take certain folk out of the work capability assessment situation. I think that the UK government needs to rethink that position. As I say, while I agree with Nanette round about constant medical assessment, what we do not want to see is constant work capability assessment. And we must ensure that those folks who, as George describes it, want to grab life and want to have their independence, have that for as long as they possibly can. And that is why it is so important that we make sure that these changes do not affect people's independence. I have to say that it is quite shocking, some of the evidence that we have had in the Welfare Reform Committee at the Your Say evidence sessions. And I think that folks should look back and see what Marlene Hepburn and others have said about what's going on. Thank you, Presiding Officer.
Thank you. Now calling Neil Finlay, to be followed by John Finney.
Thanks very much, Presiding Officer. Could I apologise? I have to go after I speak. Apologise to the Chamber. And can I absolutely congratulate George Adam on what I thought was an excellent speech. I know this illness is very close to the heart of a number of members in here, because it's a horrible, frustrating illness affecting young and old alike. In my family, my auntie suffered from it in the latter years of her life, and my brother John was diagnosed in his very early 30s. And the illness has resulted in him progressively deteriorating to the stage where he has been using a wheelchair for the last 6 years. And he has to use a car with hand controls and needs assistance in many areas of his life with all that the disease entails. But he does so whilst maintaining as much independence as he possibly can, and I think that's very much a characteristic of the people who suffer from it. The concerns that I have, and I've no doubt these concerns are shared across the Chamber, are namely with the inconsistency in treatment and advice. We see different health boards operating different policies, access to consultants almost impossible in some areas, but much more easily accessible in others. Access to specialist nurse services in some areas very inconsistent. Some people have the mobile phone number of the nurse and can speak to them almost immediately, others never having seen a specialist nurse ever. And I think the suggestion of 2 comprehensive medical reviews a year for each patient would be a revolution for some people, some sufferers. And when specialist and new drugs become available, we see people being refused or having to go through exhaustive, endless processes and appeals, pleading their case time and time again. In my brother's case, it was when beta interferon came out, and the lengthy process to go through to get the drug, which in the end, when he took it, actually made him worse, just added to the stress and anxiety. And one of the main issues with MS is mental exhaustion rather than that accompanies the physical exhaustion. I mean, I try to put myself in that position. If you can't walk a step or you can't actually swing your body, then the actual thought of getting out of bed in the morning and getting dressed must be massively stressful and exhausting. Having to go through that every day of your life before you even begin your day is something that I don't think many of us can even imagine. So, but as I've said, MS patients are hugely resilient and they cope tremendously well with an illness that at the moment has no cure. But they do need our help, they need some hope and they need our support. But in some areas that is significantly lacking. I make no party political point on that. I make that merely as an observation of someone who has family experience. Thanks.
Thank you very much. Now calling John Finney, after which we'll move to the closing speech.
Thank you, Presiding Officer. I too congratulate George on securing this debate and indeed wish the MS Society well with a full week. For refer members to my register of interests, I'm on the Board of Directors of the MS Therapy Centre in Inverness. And a year on from the debate, I spoke in the last one and I spoke about the trauma associated with diagnosis, and we heard very clearly from George Adam the circumstances of Stacey's diagnosis and the trauma that can associate it with that. And I think that picks up on another point George said, and that is it's very personal. We can talk in statistics and percentages, but when you can put a name to it, it is very meaningful. Now, I understand approximately 85% of people with MS suffer an initial short-term neurological episode known as clinically isolated syndrome. And a definitive MS diagnosis is based on a combination of factors, including medical history, neurological exams, development of a second clinical attack. These are the only medical references I'm likely to make, and exact quotes there. I did have a look online at research, and this is a layman's summary of it, and I thought there were some interesting, some interesting things. Pregnancy apparently affords female MS patients a precipitous drop in symptoms during the last half of gestation, and the researchers are looking if this benefit could be extended to people who are not pregnant. So I thought that was interesting and perhaps exciting. The Swedish Neuroscience Institute are looking at matters. A year on, people still have care demands and they still have support demands, and we've heard the challenges associated with that, and my colleague Leah McCatherine expressed some of the concerns that affect rural and landward areas. If I may be very parochial and refer to the situation in NHS Highland, where there is an identified nurse, and that identified nurse is called Anne Stewart. She's based at Regmore Hospital. She sees patients both in the hospital and at home, provides advice and support for people with multiple sclerosis, their families, friends and healthcare professionals, because I think we shouldn't forget that a number of healthcare professionals find it very challenging. She also liaises with the local MS branches and MS therapy centres, including the one in Inverness, where there's a range of treatments, including the hyperbaric chamber. And I would like to pay tribute to all the members there, Jackie McIntosh, the manager, the staff, volunteer supporters, and indeed my fellow board members, because I think it's a great rock to a number of people, that. The links with the social services are part of the specialist nurses remit, and I think that's particularly important given the integration of health and social care, where Highland Council and NHS Highland have taken a lead on. A year on, there's financial challenges still exist, and 270,000 from the Scottish Government to the MS therapy centres is welcome. Mid-Argyll are looking at developing their services and transporting them to people further afield who are out of reach. Now, a number of people have talked to the report. I want to talk to two very particular points. Unpaid care, 68% of folk spoke of that. 89% people spoke of requiring assistance, a quarter of these constant assistance. Press coverage indicates the Minister welcomes the report, and I welcome that. Malcolm Chisholm talked on the neurological clinical standards, and the National Neurological Advisory Group has identified MS as a priority, and that is very welcome, because it is about coordinating efforts. A number of people have spoken of welfare reform, and I think that is a very compelling and dark shadow looming over not just MS, but a number of other people. But I would also say everything's not right with existing arrangements, and I know someone who was unable to secure reasonable adaptations in a workplace. That's something that should have been very readily achievable in this day and age. A year on, there's still hope. I look back, and last year I said, in any fight you need resilience and strength of mind, and that is to be found in abundance among MS sufferers and their supporters. That's still the case, and I congratulate George on having the debate again. Thank you.
Many thanks. I now call the Minister, Michael Matheson, to close the debate on behalf of the Government. Minister, up to 7 minutes, please.
Thank you, Presiding Officer. Can I begin, like others, and congratulate George Adam in securing time for this important debate. And also, I'm conscious there is a Minister that has response to members' debates in a whole range of conditions. The value of someone's personal experience to these debates always puts into true relief the impact that any condition can have on an individual and a family's life. And George Adam has done that on a number of occasions now in MS debates, and it's to his credit as well. And I'm sure Stacey appreciates some of the personal information that he discloses to us at various points. But anyway, congratulations to George on the work that he has undertaken in helping to pursue issues around MS. I also want to take this opportunity to congratulate the MS Society on its 60th anniversary. They do a tremendous amount of work working with individuals in helping to improve their lives, but they also do a vital amount of promoting work around new research and also raising awareness and understanding of the condition, which is extremely valuable. And the report which they published this week is one which I do welcome. It's a balanced report, and it reflects upon the areas where good progress has been made in Scotland and in other parts of the UK, and also illustrates areas where there is further work required in order to make further improvement. And I very much share their aim, that they wish to see everyone with MS to be able to get access to the care and support that they need. And there's clearly more that we need to do, given the high prevalence level of MS here in Scotland. Now, a number of members have made reference to the national neurological standards, which were brought in January 2010, specifically to address some of the issues that Neil Findlay made in his contribution about trying to reduce the variance that can exist between different health board areas. And as a level of detailed work went into the development of those standards and work with all 14 of our territorial boards. And within those standards, there are 3 which are specific to MS, and they cover access to specialist services, diagnosis and ongoing management. Specifically, the standards state that people with MS should have access to a multidisciplinary team, which includes a consultant and an MS nurse. An MS Society acknowledges the fact that in Scotland, on the whole, people with MS have access to a broad range of specialisms. The standards also set out that people with MS should have access to a review by an MS specialist service at least once every 12 months. And it's important, if necessary, that that review can take place at an earlier stage, if necessary, through self-referral. We see the implementation of these particular standards as being key to delivering the types of improvement that the MS report this week is looking for. And in order to help to achieve that, we provided boards with funding of £1.2 million to develop local neurological improvement networks. And all 14 boards have demonstrated a real desire in order to move this forward to improve local services, although I do recognise that some are starting from different points than others, and I've got further progress still to make. But what I was very conscious is that after having established the national neurological standards, having completed the peer review, and given the willingness that had been established on the part of boards to make progress in this area, there was a need to make sure that we maintained momentum and oversight in this particular process. And that's why we established the National Neurological Advisory Group, which is a collaboration between NHS Scotland and the third sector, which is there to oversee and to support our boards to make sure that they continue to make improvements on the plans that they have developed. And as has been mentioned, the advisory group has already identified one of its initial work streams as the need to ensure consistent and equitable access to MS services right across Scotland. And I hope members will be reassured that this is not something that we are just taking forward within NHS Scotland. However, the MS Society are a key partner in delivering on this particular work stream and have a member of the work stream group to assist with that. Malcolm Chisholm also made reference in his speech to the opportunities which arise from both the neurological standards and the work that still has to be taken forward with them across our boards, and also the opportunities that come about as a result of the integration of health and social care. And I think the report recognises that, and it does provide us with good opportunities to build on the progress that has been made. One of the key issues highlighted by the MS Society in the report is concern around access to disease-modifying drugs. The UK MS Risk Share Scheme was established in 2002, including a number of drugs which patients in Scotland can access to improve, which can provided to them should they meet the Association of British Neurologists criteria for those who can benefit from the drugs in question. And more recently, the SMC have also licensed further drugs to help to treat patients with MS. Of course, clinical care is a matter for clinicians directly themselves, and we also have the Routledge Review, which is looking at how access is provided to new drugs. But it is a matter of concern that if there are drugs which are available for patients who have MS, which they are not being able to get access to within their own area, whether that is down to a lack of knowledge from the clinicians or whether it's just not having information about what the options are, is an issue of concern to me. And I've asked officials to explore how we can look at identifying what the particular barriers may be and what action can be taken in order to try and remove those barriers. In drawing my remarks to a close, Presiding Officer, a number of members have made the point about the need to make sure that those who have MS get the type of care and support they require within the community. I believe that the best type of care and support is through person-centred care. And that's why I place so much value in the benefits that can come from self-directed support and the self-directed support bill, which will come into force this time next year. The report, Presiding Officer, I believe highlights the areas where progress has been made, the areas where further progress needs to be made, but I can assure the Chamber that this administration is determined to make sure that we build on the progress that has been made so that further improvements are gained in the years to come.
Many thanks. And that concludes this evening's business. Thank you all.